Just a nurse. That's what Dr. Thornton said 43 minutes before the boy's airway collapsed and Commander O'Brien became the only thing standing between his son and death. He didn't know who she was. He had no idea what was waiting in bed 7, or why that particular chart made her hands move like someone who'd done this in Marjah when the sand was still settling on the bodies. The room went so quiet you could hear the fluorescent lights hum. Valley Memorial's pediatric ICU smells of antiseptic and recycled air, that peculiar staleness that comes from machinery breathing for you when your own lungs won't cooperate. Megan O'Brien has been here 3 months now, invisible in the way that comes from meticulous practice, her movements through the ward economical and efficient as a sniper through brush. She charts with obsessive detail, every vital sign recorded twice, every medication documented in real time before the computer systems catch up, her penmanship precise enough to be used as calibration for medical students. The other nurses think she's compulsive. They don't know she spent 8 years documenting combat casualty reports where a misread decimal point meant someone's mother would get a folded flag instead of a phone call. Her hands never tremble when she works. That part is discipline, muscle memory shaped by thousands of hours in conditions where shaking meant dying. The faint scars across her knuckles, pale lines that split the skin like a map of old fractures, are the only visible proof that those hands have held things other than 4 lines and saline flushes. The trauma shears in her scrub pocket, the ones with the engraved call sign she keeps touching through the fabric when no one's looking, that's the only other evidence. The shears are dull now, not from disuse but from being cleaned and cleaned and cleaned until the steel turned that particular shade of grey that comes from obsessive care. She tells herself it's a habit. She knows it's a talisman. Her left hand shakes slightly when helicopters pass overhead. It's the only crack in her composure, that involuntary tremor that lasts maybe 2 seconds, her fingers gripping whatever surface is nearest, a rail, a cart, the edge of a medication drawer. The sound takes her back to Marjah, to the moment when everything changed, when the decision she made in an instant rewrote 8 years of service into a single court-martial sentence. No one notices the tremor. Or if they do, they chalk it up to low blood sugar, caffeine withdrawal, the exhaustion that marks anyone working pediatric intensive care. Megan has learned that invisible is safety. Invisible is survival. Bed 7 is where the boy lies. 6 years old, skin the color of old paper, ventilator breathing for him in a rhythm that sounds like someone's sorrow made mechanical. His name is Marcus Vance, and his chart has been flagged palliative consultation pending by every attending physician who's cycled through, the kind of clinical notation that translates to, "We've given up." His father is Captain Derek Vance, a JAG officer stationed in Virginia, the man who court-martialed Megan 8 years ago with the cold procedural efficiency of someone who'd already decided her guilt before walking into the hearing. She didn't know his son would end up in her unit. She certainly didn't plan to spend her break sitting in the chair beside Marcus's bed, adjusting his monitors with mechanical precision, her face an absolutely expressionless mask while her jaw clenches tight enough to crack teeth. It's irrational. It's unprofessional. It's the one thing Megan allows herself that violates her own protocols. Every other nurse on the floor treats Marcus like a patient file, a set of vital signs, a medication schedule, a comfort care order waiting to be upgraded to do not resuscitate. Megan treats him like a person. She talks to him while she works, her voice pitched low enough that no one else can hear it clearly, narrating her movements the way she might explain strategy to a junior operator before a mission. Adjusting your head position. You're going to feel the pillow shift. That's me. That's your nurse making sure your lungs have the best angle. She braids his hair sometimes, that fine blonde hair that reminds her of things she's deliberately forgotten. She's never mentioned this to anyone. There is no box on the chart for spent 2 hours braiding a comatose child's hair because he shouldn't have to go into the dark untended. The hospital's post-surgical care unit exists in a different universe from pediatrics, all private rooms and continuous monitoring, the kind of setup where complications get caught early and outcomes tend toward favorable. Dr. Thornton runs that unit the way a conductor runs an orchestra, his movements assured, his decisions delivered with a kind of confidence that comes from never having been questioned. He's been at Valley Memorial for 7 years, built a reputation as someone who gets results, and somewhere along the way he arranged an understanding with a medical supply company that the hospital might benefit from certain equipment packages, high-end monitoring systems and surgical tables that cost more than they should but somehow do exactly what's needed. The markup is subtle, 40% over standard regional pricing, disguised across enough line items that any single charge looks reasonable. Then Megan O'Brien arrived, and her charting started documenting things. Not accusations, never accusatory language. Just facts. Item description, cost code, quantity ordered, date documented, every entry cross-referenced against the surgical log. She flagged the ventilators first, 8 units billed at $42,000 each when regional average was just under $30,000. Then the cardiac monitors, the anesthesia machines, the suction equipment. The pattern was there if you were looking for it, and Megan O'Brien looked at everything with the kind of attention that comes from 8 years of ensuring every resource, every person, every second of preparation meant the difference between a team that came home and a team that didn't. She wasn't looking to cause problems. She was just documenting what she saw. She couldn't stop herself. It was her nature. Dr. Thornton noticed on the 3rd week of August, a Tuesday morning when the operating room schedule showed 3 orthopedic cases and he was reviewing the preliminary charting. The ventilator notation caught his eye first, then the rest of them cascaded like dominoes, 14 flagged items in 90 days, every single one accurate, every single one documented in handwriting that was precise as a blueprint. He sat in his office with the door closed and did the math. $2,300,000 over the course of a contract that still had 18 months remaining. The arrangement with the supply company was secure. The CFO had the documentation filed carefully, the kickback structured as consulting fees that would take federal auditors weeks to untangle if anyone looked hard enough. But if Megan O'Brien continued documenting with that kind of meticulous attention, if she connected the pattern herself and escalated to compliance, if she mentioned anything to the wrong administrator during the wrong moment over coffee. The calculation took him 30 seconds. He pushed back from his desk and walked to the pediatric unit, his movements unhurried, his expression the pleasant mask of a senior physician conducting rounds. He needed to see this person up close. Needed to assess the threat. She was in bed 7 when he arrived, and she didn't look up when he entered the ICU, just continued adjusting the ventilator tube with the kind of care that most nurses reserved for their own family. Her hands moved like someone who'd done this thousands of times, or perhaps like someone who'd done this in contexts that required a different kind of perfection. Her badge read M. the Bryan, RN, a name that meant nothing to him, a face that could have belonged to any competent nurse in any hospital in America. She was probably 35, maybe younger, with the kind of bone structure that suggested either good genetics or a life lived without excess. Her eyes, when she finally did look up at him, were the color of a winter Atlantic, and they assessed him in roughly 2 seconds the way a sniper assesses a target. "Doctor," she said, her voice pitched low, professional. Not deferential exactly. Just neutral. Just the careful calm of someone who'd learned that visibility led to complications. "Ms. O'Brien." He smiled. Not a kind smile. A smile like a wolf showing its teeth. "You're the one spending so much time with this patient. Excellent work. Really excellent attention to detail." He gestured at Marcus without looking at him, the gesture of someone indicating a piece of equipment rather than a human being. "We should have you focus that energy where it's needed most. You know, on patients with actual prognosis." She turned back to the ventilator monitor. Her jaw tightened just barely, a muscle flexing once. "I finish what I start, doctor." And that was when Dr. Thornton knew she was going to be a problem. Not a nurse with excessive compassion. Not a caregiver overinvesting in a terminal case. A person with institutional pattern recognition, someone who saw the way systems worked and couldn't help but notice when they were corrupted. Someone with the kind of discipline required to maintain perfect composure while her hands adjusted equipment with the precision of someone who'd learned to trust her own reflexes more than protocol. He left the ICU thinking about removal strategies, about how to position her as a liability without ever mentioning her charting, about how to make it clear that this hospital didn't have room for nurses who saw too much, understood too much, documented too much. What he didn't know was that the girl in bed 7 wasn't just another terminal case. What he didn't know was that Marcus Vance's father had court-martialed the same woman 7 years earlier, and that Megan O'Brien had accepted that judgment in silence, had walked away from her career and her identity, had disappeared into Jacksonville's healthcare system specifically because she had no one left to fight. What he didn't know was that his assumption of invisibility was about to become the most expensive mistake of his professional life. But that wasn't the worst part. The worst part was that Megan O'Brien didn't know yet either. Thursday morning arrived with the weight of fluorescent lights and the smell of institutional coffee that had been warming since dawn. The Grand Rounds conference room at Valley Memorial was packed. 23 residents and attending physicians crowded into the space, their voices a low murmur until Dr. Thornton dimmed the lights and pulled up patient charts on the projector screen. Megan stood against the back wall, her hands clasped behind her back in a posture she didn't realize was parade rest, a muscle memory from 8 years of briefings she'd left behind in Marjah. This case demonstrates a critical failure in professional boundaries, Thornton announced, his voice carrying the confident drawl of a man who had never been questioned in his own domain. He circled a set of handwritten notes on the screen, her notes. Megan's documentation of the Vance boys' care, meticulous and dated, expanded to show one entry from 3 days prior. 47 minutes spent at bedside. Pupil response assessment. Range of motion evaluation. Skin integrity check. Nurse O'Brien here seems to believe she's running a daycare rather than an intensive care unit. He paused for effect, letting the words settle. Perhaps she's confused about her role. The resident smirked. Someone whispered something that made 2 others exchange knowing glances. The sound of pens scratching on notepads filled the silence. Megan's jaw tightened, just barely, just enough that her own muscles felt the resistance, but her face remained a perfect mask, the kind of composure that comes from having watched men die while maintaining eye contact with their families. Her fingers pressed into her palms hard enough to leave white crescents. Some of our staff, Thornton continued, turning to address the residents directly as if Megan had already left the room, seem to believe that their nursing degree qualifies them to question physician orders, to second-guess clinical decisions, to insert their personal feelings into cases that require objective analysis. He clicked to another slide. It does not. Nursing is a vital support function. It is not medicine. Let's be clear about that distinction. Another pause. Another dozen sets of eyes flickering toward the back wall where Megan stood perfectly still. Emotional attachment to patients is how people get killed. Compassion fatigue leads to error. An error in this unit is not tolerated. The meeting continued for another 30 minutes, but Megan had stopped listening somewhere around minute 3. She'd learned long ago that once the narrative was set, resistance only reinforced it. Better to be the quiet one. The invisible one. The one who absorbed the blow and moved forward. She'd survived worse than this. She'd survived Marjah, where the sound of helicopter rotors still woke her at 3 in the morning. Compared to that, this was just words in a room full of people who would forget about her by lunch. 3 days later, Thornton engineered his second strike with the precision of someone who understood institutional choreography. The break room at 07 for 5 hours, 6 nurses and 2 residents present, all drawn by the promise of fresh donuts from the morning delivery. Megan was reaching for her coffee when Thornton's voice cut through the room like a blade. Nurse O'Brien. I've been wondering, did they require special training to qualify you for your last position, or did the bedpan experience alone suffice? Someone laughed. A nervous, uncertain sound that told her Thornton had established dominance enough that people would follow where he led. Megan's hand stayed steady as she retrieved her cup. The coffee was still hot enough to steam. She could smell the bitter grounds beneath the surface, the artificial sweetener someone had dumped into the communal pot. She turned to face him, her voice measured and flat. I'll review the competency protocols, Dr. Thornton. That's what I appreciate about you, he said, stepping closer, his voice dropping to the stage whisper that only sounds private to the person it's directed at. You know your place. You know your limitations. He was close enough now that she could smell his cologne, something expensive and aggressive, layered over the antiseptic tang of his morning shower. "I've been reviewing your background, Nurse O'Brien. Your employment history, your credentials, your origins, let's say. Not much there, is there? Just appeared out of nowhere 8 months ago. Makes one wonder what you're running from." The room had gone quiet. Not the quiet of conversation pausing, the quiet of people pretending they weren't listening while listening intently. Megan held his gaze for exactly 2 seconds, then returned her attention to her coffee. "My references have been verified by HR. Yes, yes. Very mysterious references. Very sparse details for someone with such specialized interests." He smiled, and it was the smile of a predator that had already tasted blood. "We should have lunch sometime. Talk about your future here at Valley Memorial." That evening, Thornton paged her to the nursing station with the kind of urgency that made her think something had happened with one of the patients. Instead, she found him standing over the medication dispensary, his hand already writing on the order form. "The Vance boy. Morphine." The dose made her eyes pause before her brain fully processed what she was seeing, 15 milligrams for every 4 hours. For a 6-year-old. Pediatric dosing for morphine in post-operative situations was 0.1 to 0.2 milligrams per kilogram. The Vance boy weighed maybe 40 pounds. Safe dosing would be 2 to 4 milligrams every 4 hours. Thornton's order was 40% above even the aggressive upper limit. It was the kind of dose you wrote when you wanted someone to stop breathing and not wake up. Megan's hands moved before her mind caught up, pulling up the protocol on the computer terminal, her fingers steady on the keyboard. "Dr. Thornton, this exceeds pediatric safety parameters by 40%. Yes, I can do math." His voice had changed. Gone cold. "You want to practice medicine, Nurse O'Brien? Go to medical school. Get your MD. Until then, you follow my orders or security will escort you out of this hospital in handcuffs. Are we clear, Bedpan?" The nickname hung in the air between them like a physical thing. She could feel the residents at the far end of the nursing station suddenly very interested in their own workstations. A printer hummed. A monitor beat somewhere on the ward. The fluorescent lights overhead buzzed their constant hum, a sound that had become the background noise of her slow dissolution in this place. "Crystal clear, Dr. Thornton." She logged out of the computer and clipped her badge back to her scrubs. "Good." He signed the order with a flourish. "I'll be watching your documentation very carefully now. Any further insubordination, any further attempts to practice medicine without a license, and we'll have a conversation with hospital security that will end very differently than you might hope." "Understood." She nodded once and walked away from the nursing station without another word. The supply closet on the 3rd floor was where she went, a small room packed with linens and 4 supplies, the door that locked from the inside. Megan closed it behind her and gripped the metal shelf in front of her until her knuckles went white, the blood draining from her fingers leaving them pale and ghostly under the fluorescent light that buzzed through the small opening near the door. Her trauma shears were still in her pocket, engraved with the call sign that no one here could read, that meant nothing to the people around her. Valkyrie. The call sign she'd earned after the mission in Marjah that killed 2 sailors under her command, 2 women she'd trained, 2 women whose names she still spoke aloud some nights at 3 in the morning when sleep wouldn't come. She pressed the shears against her ribs, feeling the shape of them through the fabric of her scrubs, the weight of metal against bone. The truth was that she could have challenged him. She could have walked into that nursing director's office and made a formal complaint. She could have cited protocol, cited safety, cited federal regulations about medication dosing in pediatric care. But that would have required explaining who she was, and she wasn't ready to explain who she was, and more importantly, she wasn't sure anyone here would believe her anyway. What happened next didn't just surprise her. It changed the entire trajectory of what everyone at Valley Memorial believed was possible. The pediatric ICU at Valley Memorial hummed with the quiet machinery of sleep. Ventilators wheezed their mechanical rhythms. Heart monitors beeped in steady intervals. Megan moved through the rows of small bodies with the precision of someone who had made routine out of ritual, checking drips, adjusting alarms, recording vitals with the kind of meticulous notation that had already cost her a career once and would cost her again before the night was finished. It was 1900 hours when she started her rounds. The fluorescent lights cast everything in a sickly white that made the children look smaller than they were. She made it through 6 beds, 7, 8, checking medication drips, confirming oxygen saturations, reading the stories written in vital sign numbers like a fluent speaker reading a familiar language. At bed 9, she stopped. Captain Derek Vance's son lay motionless, his small chest rising and falling with the regularity of the ventilator that breathed for him. For 67 days, this child had not woken. For 67 days, Megan had been the only nurse at Valley Memorial who treated him as if he might. She held his hand during her breaks. She spoke to him in low, steady tones. She read the medical charts the way she once read tactical maps, looking for patterns, for the truth hiding beneath the surface. His oxygen saturation read 94%. Normal. She made a note and moved on. At 21:47, something changed. She noticed it between her rounds, in the pattern of his breathing. A subtle wrongness. His saturation drifted down like a sunset, 94, 92, 89, gradual enough that the alarm hadn't triggered, a slow whisper of decline that most nurses would have attributed to the ventilator settings or positioning. Megan had learned in Marjah to listen to the whispers. Whispers killed people before screams ever got started. She approached the bed and placed her hand on his chest. The expansion felt shallow. Labored. She checked the ventilator, settings correct. She checked for secretions blocking the endotracheal tube, clear. She listened to his lungs through the stethoscope, air moving, but strained, asymmetrical. The oxygen wasn't the problem. The oxygen was a symptom. His airway was failing. She pulled the chart. 47 days of imaging. 52 CT scans. 3 MRIs. Every one of them missed the same structural abnormality, a tracheal narrowing from scar tissue, congenital stenosis that had never been critical because the child had been breathing on his own before the accident. But with a ventilator doing the work, the narrowing meant less flow, less oxygen delivery, a slowly tightening noose that would become critical within hours. Megan paged the attending physician at 21:51. No answer. She paged again at 21:57. This time, she waited. The page system crackled, ICU, go ahead. Not the attending. A resident. One of the doctors who had smirked during grand rounds. Pediatric patient, bed 9, Megan said, her voice flat as a runway. Needs respiratory assessment. Possible airway compromise. He's on a vent. He's stable. Oxygen saturation trending down. Request immediate evaluation. Silence. Then I'm with an admission. Probably just positioning. Reposition and call back if it gets worse. The line went dead. Megan repositioned the child. The saturation climbed 3 points. Then it began falling again. 85. 83. She called again at 22:03. Different resident answered this time. She explained again. She was told again to wait. To monitor. To call if anything changed. At 22:03:15, something changed. The boy's body went rigid. Seizure. His back arched against the mattress and his eyes rolled back and every muscle went tight as a fist. The ventilator alarm screamed. The saturation fell like a stone, 94 to 80 to 68 in 30 seconds, and his lips began turning the shade of twilight blue. Megan hit the code button without hesitation. She was already at the bedside, already moving. Her hands went to the bag mask ventilator, already knowing what she would find. She squeezed the bag. No air passed. She squeezed again. The resistance was absolute. The child's airway had narrowed down to nothing. Whatever was happening inside that throat, swelling, spasm, anatomical malformation suddenly critical, it was complete obstruction. The monitors screamed. The boy's oxygen saturation dropped to 62. 58, 55. The code team arrived at 22:05:22. 2 residents. A respiratory therapist. A nursing supervisor who had been charting at the desk. They came running, and they saw exactly what Megan was seeing, a comatose 6-year-old child whose lips were the color of cyanosis and whose brain was being starved of oxygen at a rate that meant brain death in minutes. Bag him, the senior resident said. Already tried, Megan said. Complete obstruction. Airways collapsed. The resident tried anyway. The bag mask produced nothing but resistance. He tried again. Still nothing. His hands began to shake. We need to intubate. Can't pass the obstruction. Then we get a larger tube. There's no larger tube that will fit a pediatric trachea that's narrow enough to stop all flow. Silence. The monitors kept screaming. Oxygen saturation, 51. 48, 45. We need an attending. We need surgical consultation. This is above our. There's no time, Megan said. Her voice had changed. Not louder. Lower. The kind of quiet that stops rooms. The kind of quiet that comes from someone who had stood in desert heat with bullets in the air and had learned to speak the language of crisis as fluently as breathing. She was already moving. Her hands went to her pocket. Her trauma shears, 7 inches of surgical steel, the handles worn smooth from 1,000 procedures, the blades engraved with the call sign Valkyrie in letters so small that only someone looking for them would find them, came out into the light like a secret finally being told. The resident stared. You can't do that, the senior resident said. That's outside your scope of practice. You're a nurse. You're not even. Get out of my way. It wasn't a request. It wasn't phrased like a question. It was something else entirely. Command. Absolute. The voice of someone accustomed to being obeyed, and the young resident actually stepped backward without quite knowing why. Oxygen saturation, 42. 39. Megan positioned the child's head back, her left hand finding the landmarks she had located 1,000 times before. The thyroid cartilage. The cricoid cartilage below it. The narrow space between them where the membrane stretched. The space that was perhaps a 1/4 inch wide in a child this small. The space where she had pushed a tube through 17 times in Marjah, working by the light of headlamps or the flash of detonations, learning that sometimes the difference between living and dying came down to knowing exactly where to cut. Her hands didn't shake. The shears came down. One clean motion. The blade slid through skin and membrane. The release was immediate. She could feel the change in pressure, the sudden opening where there had been none. Air moved. The ventilator suddenly had somewhere to go. Blood beaded at the sight. Not much. She didn't pause for it. She was already positioning a tube, already securing it, already connecting the ventilator line. The bag began to move. The lungs expanded. The monitors climbed. Oxygen saturation, 68. 72, 78. 84. Sinus rhythm on the cardiac monitor. The child's color began to shift from cyanosis back toward something almost alive. Get me a surgical tracheostomy kit, Megan said. And call Dr. Thornton. Tell him we have a complication that needs documentation. The respiratory therapist moved without question. The nursing supervisor stood frozen, her hand over her mouth. The 2 residents stood in a silence so complete that the only sound was the ventilator moving air, the monitors steadying into rhythm, the small unconscious breaths of a child who would live because the person holding the shears had refused to let him die. But that wasn't the worst part, as far as Dr. Thornton would see it when the incident report was filed at 0600 hours. The worst part, from his perspective, was that she had done it. That she had crossed a line that could not be uncrossed. That she had saved a life using a technique that required knowledge no pediatric nurse could possibly possess without extraordinary background. The worst part was that she had left a trail. And Dr. Thornton, standing in the empty hallway at 0637 when his phone rang with a call from the hospital's risk management consultant, would see immediately that the game had changed. The cricothyroid membrane was exactly where her hands remembered it. Palpation. 2 fingers finding the space between cartilage rings like reading Braille in the dark. The boy's airway was collapsing, not slowly, not with warning, but all at once, like a door slamming shut on a child who'd been breathing for 6 years and would stop breathing in seconds. The code team stood frozen. Residents watched. Monitors screamed their electronic panic into the fluorescent-lit ICU as oxygen saturation plummeted, 68, 64, 61. Megan moved. The trauma shears came from her pocket in one fluid motion, the metal warm against her palm like it had been waiting for this exact moment for 8 years. Her hands didn't ask permission. They didn't hesitate. They knew. Muscle memory from Marjah moved her fingers, identify the landmarks, palpate the membrane, position the blade. In her peripheral vision, a resident was saying something about calling the attending, about protocols, about scope of practice, but his voice sounded like it was coming from underwater. Time had compressed into something smaller and sharper. Just her hands. Just the blade. Just the child who would be dead in 90 seconds if she didn't move. The incision was horizontal, deliberate, less than an inch. The shears cut through skin and soft tissue with a whisper, no resistance, no hesitation. Blunt dissection with her fingertip widening the space. Blood, minimal. She'd seen worse. She'd done this 43 times in Sanjin Valley with bullets coming through the canvas walls of a forward surgical tent, but this was different because this was a child and his name was Marcus and he was 6 years old and he had a father who'd destroyed her career once already. The endotracheal tube, pediatric, 4.0, already prepped on the crash cart, slid through the cricothyroid membrane with almost no resistance. Air moved past the blockage. Breath returned. The child's chest rose, fell, rose again with the rhythm of a person who wasn't dying anymore. Oxygen saturation climbed, 71, 78, 85, 92, 96. Stable. The monitor alarm silenced one by one, replaced by the steady beep of a normal sinus rhythm. The room exhaled. Residents who'd been frozen suddenly moved again, checking vitals, adjusting sedation, doing the dozen small things that came after the impossible had already been done. Nobody looked at Megan. That was the real tell, not the stunned silence but the deliberate absence of eye contact, the way people avoid staring at something they don't have language for. Megan's hands were perfectly steady as she secured the tube with sutures, her face showing nothing, no triumph, no relief, no emotion at all. Just a nurse finishing a procedure. Just a nurse who'd learned to keep her hands steady while helicopters landed and people screamed. Just a nurse who understood that the smallest tremor, the tiniest crack in composure, would be the thing that unraveled everything. But somewhere in the back of her mind, she heard the rotor wash. She heard the Black Hawk's engines and someone calling her name and blood pooling on a concrete floor in a place called Marjah where 8 years had been compressed into moments that never really ended. Dr. Thornton appeared at 03 for 7 hours. He didn't come to congratulate her. He came because he understood exactly what he'd just witnessed, a pediatric nurse performing a surgical procedure with the precision and muscle memory of someone trained in combat medicine. A nurse who should not have been capable of that. A nurse whose hands knew things that normal hands didn't know. The ICU doors slid open and he walked straight to the bedside, his face a mask of professional concern, his eyes calculating. He looked at the secured airway. He looked at Marcus's vital signs stabilizing on the monitor. He looked at Megan. And then he turned and left without saying a single word. By 05:20 hours, he'd made 4 phone calls. The first to Richard Holstead, the board chairman, whom he reached on a golf course in Ponte Vedra Beach. "We have a serious compliance issue. A nurse just performed an emergency surgical procedure without physician oversight. Textbook scope of practice violation. We need to move fast before she becomes a liability." The second to Dr. Patricia Chen, the nursing director who'd buried 3 malpractice complaints against Thornton in exchange for favorable credentialing letters. I need a termination letter drafted. Emergency. I'm sending you the incident report. The third to his attorney. The fourth to Healthcare Risk Solutions, where he had a friend named James Everett who specialized in limiting institutional liability. By 05:20, Megan was still in the ICU, monitoring Marcus's post-procedure vitals, charting the emergency intervention with clinical precision. By 05:47, Thornton had his termination letter typed, printed, and sitting in a folder with her name embossed on the tab. By 0600, he'd practiced saying it aloud in his office mirror, "You're fired." Effective immediately. He hand-delivered it at shift change in front of 2 security guards, because he understood that witnesses transformed a firing into theater. That official presentation mattered more than the content of what was being said. The guards flanked him like he was delivering a court order, and maybe in a way he was, the order of a man with power destroying a woman with none, because she'd looked at his fraudulent scheme and refused to pretend she hadn't seen it. "You're done, bedpan," he said, using the vending machine nickname like it was his right. Effective immediately. Gross violation of scope of practice protocols requiring physician supervision. Reckless endangerment of a pediatric patient. Your badge and ID. Now. Megan accepted the letter in complete silence. Her jaw didn't tighten. Her hands didn't shake. She didn't explain that a pediatric nurse didn't learn to perform an emergency cricothyrotomy from YouTube videos, that it came from 8 years of training with the Navy SEAL teams, from standing in operating tents with the sky falling and people dying, and the only difference between saving someone and losing them being the steadiness of your hands. She didn't defend herself because any defense would require telling the truth, and the truth was classified, and the truth wasn't her right to tell. She surrendered her badge without a word. It had her photograph on it from 6 months ago when she'd still been pretending that she'd come to Jacksonville to disappear, not to be found. She placed it in Thornton's palm and he closed his fingers around it like he'd won something. The rock bottom came 90 minutes later. The basement laundry room at Valley Memorial was a place most people never saw, fluorescent lights buzzing with the kind of low-frequency hum that made your teeth ache if you listened to it too long, industrial washing machines the size of small cars, and rows of hanging scrubs waiting to be processed. The room smelled like bleach and hot cotton and something underneath it that was just the smell of hospitals, antiseptic and sweat and the particular mustiness of places where people in crisis left pieces of themselves behind. Megan stood in front of the hanging hooks where her uniforms waited. She pulled down the Valley Memorial scrubs one piece at a time, the top, the bottom, the jacket she'd worn every single shift for 8 months. The fabric was still damp from the night shift, and she carried them to the folding station and began the ritual of precision that had been drilled into her so deep it had replaced the parts of her that didn't need military discipline to survive. Fold the top. Crease the sleeves to sharp right angles. Crease the center line. Fold again. Fold the bottom. Align the seams. The Valley Memorial Hospital logo stared up at her from the fabric, the name that would be in the incident reports, the name that would appear in the Board of Nursing investigation, the name that would end up in whatever file Thornton was already constructing about her. Another fold. The edges meeting perfectly. This was what she'd learned in the teams, that precision under pressure was the difference between success and failure, that muscle memory could override panic, that if you folded your uniforms with enough care you didn't have to think about what came next. Just the next crease. Just the next fold. Just keep your hands moving. She placed the folded scrubs in the return bin with all the other uniforms, other nurses, other shifts, other people who got to keep their jobs. The fabric settled against the others, indistinguishable now, just part of the pile. Just another uniform she'd failed to keep. The trauma shears were still in her pocket. She could feel them pressing against her ribs, the metal warm against her body, the engraved call sign, Valkyrie, the call sign from Charlie Platoon, the call sign from Marjah, catching the fluorescent light and throwing it back at her like her accusation. She left through the service entrance at 0713 hours. Nobody stopped her. Nobody was looking. The Jacksonville morning was already hot and humid, the air pressing down like a hand on her chest, and she walked into it without looking back because that was the only thing she knew how to do anymore. Keep walking, keep breathing, keep your face blank and your hand steady, and don't let anyone see that you're already 3,000 miles away in a place where women who save lives are supposed to disappear quietly and take their trauma shears with them. The sunshine felt like punishment. The Jacksonville morning was already hot and humid, the air pressing down like a hand on her chest, and she walked into it without looking back because that was the only thing she knew how to do anymore. Keep walking, keep breathing, keep your face blank and your hand steady, and don't let anyone see that you're already 3,000 miles away in a place where women who save lives are supposed to disappear quietly and take their trauma shears with them. Dr. Thornton spent that night in his office at Valley Memorial, the mahogany door locked, his attorney on speakerphone from Miami. "Exposure is coming," the attorney said, his voice carrying the calculated precision of a man who'd spent 30 years burying problems. "The boy's father knows who she is now. The medical board will investigate. We need to control the narrative before the full truth emerges." Thornton sat in his ergonomic chair, imported Italian leather, cost him $8,000, and listened to his attorney draft statements on the fly. "We position her as a fraud. Stolen Vela. An unqualified pretender who performed an unauthorized procedure to cover her incompetence." The words were smooth, rehearsed, the kind of language that had walked other men away from worse. "You're a respected physician protecting your hospital from liability. That's the story." Thornton nodded, even though the attorney couldn't see him. "When?" "First light. Local news. WJCT Morning Show. Monica Reeves owes you a favor from the cardiology wing donation. Go in angry. Go in righteous. Control the room." The attorney hung up without saying goodbye. Thornton sat alone in the darkness, his fingers drumming against his desk, a rhythm like a helicopter blade, like incoming fire, like the sound of his own career collapsing if he didn't move first. At 8:30 the next morning, Dr. Thornton sat across from Monica Reeves in the WJCT studio, his face arranged in an expression of grave concern. He wore a navy suit, the tie a subtle power red, his hands folded on the desk with the practiced calm of a man about to destroy someone. The studio lights were bright, professional, the kind that made ordinary people look trustworthy. He'd practiced this moment in his bathroom mirror for 2 hours. This woman calling herself a commander performed an unauthorized surgical procedure on a pediatric patient, Thornton began, his voice dripping with manufactured righteousness. "We have a responsibility to protect our patients from unqualified pretenders who fabricate military service to..." His phone rang. Not his cell phone. The studio line. Monica glanced at her producer, then back at Thornton. "We have an incoming call," she said carefully, her journalist instinct already firing. "From the Secretary of the Navy." The room's temperature shifted. Thornton's jaw tightened, just barely, just enough to register, but his expression remained composed. Monica put the call on air. "Dr. Thornton, this is Secretary Admiral James Morrison." The voice filled the studio like thunder, measured and authoritative, the kind of voice that had commanded aircraft carriers and shaped military policy. "I'm calling to inform you and your audience that Commander Megan O'Brien's service record is authentic, classified, and beyond reproach. I'm also calling to inform you that the Naval Criminal Investigative Service has concluded a 6-month investigation into your fraudulent billing scheme with Surgical Solutions Unlimited." The silence that followed was the kind that happens in hospital rooms when someone's heart stops. $2.3 million in phantom equipment charges billed to Tricare for military dependents, including the care of Captain Vance's son. Monica's professional composure cracked slightly, her eyes widening. "The Justice Department will be filing federal charges Monday morning. Thank you for providing such a public forum for this announcement." The line went dead. Thornton's hands remained folded on the desk, but his fingers had stopped moving. Monica waited for a response, her microphone still hot. "Dr. Thornton? Would you like to respond?" He removed his microphone with movements that weren't quite steady. He stood. He walked off the set without speaking. The camera kept rolling, capturing the empty chair, the shocked silence of the studio audience. The clip went viral in 3 hours, 4.2 million views by midnight. Regional news picked it up by noon. National outlets by 2 p.m. The tagline became a meme: Navy Secretary destroys Doctor live on air. Valley Memorial's board suspended Dr. Thornton by 5 that evening, pending investigation. The Florida Medical Board revoked his license 72 hours later. Texas followed within the week. Louisiana and Georgia followed within 10 days. His medical practice, built over 23 years, collapsed in less than 2 weeks. His attorney returned his calls exactly once. "We're done," the attorney said. "The exposure is too extensive. Find someone else." 6 months later, Megan stood in Valley Memorial's pediatric intensive care unit, her badge clipped to her scrub pocket, the same badge they'd tried to take from her, the same unit she'd thought she'd lost forever. The hospital board had issued a formal apology in writing, a commendation for life-saving actions under pressure, and a quiet reinstatement without the publicity that might have invited questions about her background. Nobody asked about the engraved trauma shears or the classified call sign or why a pediatric nurse knew combat surgical procedures. Sometimes the organizations that benefit from buried truths have the institutional discipline to keep burying them. She was just grateful to be back. Through the observation glass, Captain Derek Vance's son took his first steps in physical therapy. 6 years old, speaking again, his cognitive function returning beyond what any neurologist had predicted possible when he'd seized with a collapsed airway. The trauma shears hung from a chain around his small neck, a gift from the woman who'd saved him, the engraved Valkyrie call sign catching the afternoon light in a way that looked almost intentional, like a promise made visible. Captain Vance stood beside Megan, his Navy uniform traded for civilian clothes during his extended family leave. He'd taken 6 months away from his JG duties. Megan understood the weight of that choice. "I spent 3 years trying to find you to apologize," he said quietly. "You didn't make it easy." "That was the point, sir." They watched his son take another step, the physical therapist guiding his arm, the boy's face concentrated with the effort of becoming whole again. "He wouldn't be here without you. I wouldn't have a son." Megan's face remained neutral, her hand steady as she observed the boy's gait, the slight favoring of his right leg from the prolonged immobility. "I was just doing my job." The words were true, which made them easier to say. Captain Vance didn't respond immediately. He understood what job she meant. Across the parking lot, visible through the far window if you knew where to look, Dr. Thornton sat at a folding table outside a strip mall pharmacy. The table was white, collapsible, the kind you rented for $40 a month. His supplemental insurance brochures were laminated in plastic sleeves, arranged in neat rows. A woman walked past without stopping. He adjusted his tie, a habit from his old life that still clung to him like smoke, and waited for the next person. His medical license hung on a wall in his apartment, framed and useless. The revocation letter from For States occupied a drawer. He was 48 years old and the only job that would hire him involved commission-based insurance sales in a medical complex where his colleagues recognized him and turned away. Nobody stopped at his table. The afternoon heat was relentless, the asphalt radiating up from beneath his shoes like a slow punishment. Back in the ICU, Dr. Parks approached Megan with the hospital's chief of nursing, offering her a position redesigning emergency protocols, more authority, less bedside work. Megan declined without hesitation. "I prefer direct patient care." They accepted her answer because her credentials now made her untouchable, and her preference for bedside work was something they'd learned not to question. That evening, as Megan completed her charting, meticulous, precise, the kind of documentation that would hold up in court or congressional testimony, Captain Vance's son brought her the trauma shears. He held them out carefully, his 6-year-old hands treating the instrument with the seriousness of a sacrament. "My dad says these saved me." "What do the letters mean?" Megan kneeled down to his eye level. Her scarred hands, the hands that had held him together through medical crisis, were steady as they took the shears from him. "They mean someone trusted me to do the right thing, even when it was hard." The boy considered this with the grave expression of a child who'd already understood what it meant to survive something that shouldn't be survivable. "Did you?" "I tried. She stood, returning the shears to him carefully, watching as he rejoined his father by the doorway. She disappeared back into the rhythm of the ICU, the beeping monitors, the steady wheeze of ventilators, the hiss of oxygen lines, the whispered conversations of night shift nurses who understood that this work happened in the spaces between life and death. The fluorescent lights hummed their familiar frequency, a sound she'd learned to love instead of fear. The hospital smelled like antiseptic and determination, like the particular alchemy of people choosing to save each other when the world wasn't watching. Megan thought about her commander's words from Marjah, the one she'd carried for 8 years like a piece of shrapnel that never quite worked its way out. True class is what you do when the lights go out. She'd spent 8 years learning how to disappear into uniforms and mission briefs, and 6 months learning how to disappear into hospital corridors instead. Both required the same skill set, the ability to do what needed doing without needing anyone to see you do it. She'd learned to save lives in war zones where nobody knew her name. She'd learned to save lives in emergency rooms where people assumed she was just a nurse. The only thing that had changed was the uniform. The work remained sacred. As she made her final notes on the chart, she heard the boy's voice from the hallway, "Can I really be a doctor too?" And his father's response, steady and sure, "If that's what you want, son. You can be anything." Megan didn't look up from her charting. She didn't need to. She'd already seen the future in that boy's eyes, and it looked like redemption. If you're watching this and you've ever been underestimated by someone who didn't know your value, who didn't see what you were actually capable of, don't just watch. Subscribe. Leave a comment. Tell us your story. Because the world needs to hear about the quiet ones, the ones who carry their strength in silence, the ones who save lives when nobody's watching. Hit that notification bell so you never miss the next story of hidden heroism.